Hey, good morning, everyone. Thanks so much for joining me here on Wave Now's Ask the Doc. I'm Myra Ansari with Dr. Elizabeth Dahl, a neurologist with Norton Children's, here to talk to us about migraines in kids. Now, as an adult, I have suffered through migraines they kind of started the past 5 years. If you have them, you know how awful and horrible and how debilitating they are. And thanks to the help of Norton, I was able to finally see a doctor, get some help, get the right medication. So now I don't go through that horrible trauma when it's happening, because it's the worst. And people may not realize, Dr. Dahl, that migraines happen in kids too. What do we know about migraines in children?
So, believe it or not, migraines actually typically start in childhood or adolescence. So if you talk to even adults, they'll say that they started having headaches when they were younger and may not have been recognized as migraines. But fortunately, I think pediatricians and families are probably more educated on what migraines are, and so they are coming to our attention now. About 1 in 10 kids have migraines, so it's very common.
So what is the difference between just like a regular headache and a migraine?
Okay, so migraines probably constitute about 95% of the headaches that we see in our neurology clinic. And a migraine headache is a very severe, disabling headache that typically causes like a throbbing or pulsating pain in the head. In adults, it tends to be on one side, but in children, it's typically on both sides. It can, cause a child to not be able to function normally. They'll need to lay down and rest when they have a headache. Also, they may have sensitivity to light or noises,
movement,
nausea, yes, lightheadedness.
So they can start at what typical age do we start to see them in kids?
Well, it depends. Boys actually tend to start having migraines earlier than girls. 6 or 7 years of age. And then girls usually around 10, 11, 12. But once girls catch up, they start to outpace boys pretty significantly. So migraines are 3 times as common in girls as in boys.
Wow. Okay. If you have a question for Dr. Dahl here, if you're joining us, please share it in the comments and we will try to get them answered. Again, today's topic is about migraines in kids. Are they genetic? I'm worried that because I have them, are my kids going to have them too?
So yes, unfortunately, they do tend to have a genetic tendency. So, if one parent has a migraine, then the child has like a 50% chance of having migraine, and then it goes up if both parents have a history of migraine. So most of the time when I'm seeing a patient, I'll get the history that some family members have had migraines before.
Are there triggers for kids?
Sure. There's a gazillion different triggers. And so sometimes it can be helpful for families to kind of keep a journal or log of when they're having the headaches, like what have they done in that time period in terms of eating certain foods? Have they been drinking enough water? Getting good sleep, things like that. But the most common triggers tend to be stress. So stress is probably the number one trigger for migraines. We know that, again, like dehydration, if kids are skipping meals, if they're not sleeping well at night, if they're, drinking too many caffeinated beverages, things like that, can definitely kind of exacerbate migraines.
Signs and symptoms. Talk to me about that, Dr. Dahl.
Sure. So, in younger kids, it can sometimes be harder for them to
vocalize it.
Yes. So you have to kind of become a detective and kind of, if the child is just not acting like a normal kid and they're, wanting to lay down in a dark room, grabbing at their head, then those are likely symptoms of migraine. I mentioned earlier the sensitivities to light, noises, nausea, obviously the pain in the head. There's sometimes what's called an aura with a headache. So about 20-25% of patients with migraine have aura. And that is basically kind of an abnormal sensation. The most common is a visual aura, so kind of changes in vision, like seeing spots, zigzags. But you can also have kind of numbness, tingling. You can have other scarier things that we don't see that commonly, like even stroke-like symptoms. But by and large, most people that have migraines do not have an aura. And then kind of a small subset do.
So that can be pretty frightening for a parent if their kid's kind of telling them all these symptoms, right? Mm-hmm. Sometimes I feel bad saying this, but you tell your kid, just rest, just sleep it off. I'll give you a Tylenol. You'll be fine. Sure. At what point should a parent start to be like, okay, I need to start doing some digging? Maybe, is it more than one? Is it frequent headaches that they're coming up with?
Well, the textbook definition is that you have to have 5 attacks in a lifetime to call it a migraine. But, if there's kind of a strong family history and, it looks like a migraine, then I would treat it as such. Ibuprofen tends to be a little bit more effective than acetaminophen for migraine. So I would at least start there. Okay. And, make sure that the child is hydrated. Even like a little bit of electrolyte solution can be helpful. And then if that's not cutting it, then we sometimes use a class of medicines called triptans. Rizatriptan, sumatriptan. And those are kind of a class of medicines that are designed for migraine and may be a little bit more effective than just kind of over-the-counter treatments.
Yeah. Yes. Those tend to work pretty quickly too.
Yes. Yeah. And I was going to mention too, if they've kind of starting to have more frequent headaches and they're having to kind of use a lot of acute treatments, then at that point we would recommend that they start on a preventative type of treatment. And so there's a lot of different treatments available now in terms of, anywhere from nutraceuticals like magnesium or CoQ10 to amitriptyline and topiramate that, have a lot of evidence for use and effectiveness in children.
Okay. I want to talk more about that in just a second. But how do we know, how have we seen just life in general impacted for kids who suffer from migraines, socially, emotionally, education, and physically? How are they impacted?
Sure. So, obviously we want kids to be kids, and we want them to be happy and live healthy, happy lives. And so kids have kind of 2 main jobs. The first is, being happy and having fun and being able to go out and play sports or, play music or whatever they like to do. And the second is going to school. And so, when you have migraines, it can definitely impact your ability to go to school, to attend, to perform well academically. And then, in terms of extracurricular activities or hanging out with friends, if you have a migraine, you just don't feel good and you don't want to do those things. So it can be quite debilitating.
Absolutely. What have we seen over the years? Do you think more kids are getting migraines? What are we able to identify them a little bit better? Is there any trend that we've noticed?
Yeah, I think that it's remained fairly stable, maybe a little bit of an uptick since COVID, with kind of a lot of screen time. And, I think that some of the isolation related to COVID probably didn't help either. So I do think that we're probably seeing more migraines, and also kind of, we're also seeing that it's being better recognized as well.
Okay. Well, that's a good thing. So Alex wrote, having had a stroke, watch your blood pressure. Alex, I'm so sorry that you had to go through that. I'm sure that had to be very frightening. So we were talking about, Dr. Dahl, like I take daily medication to prevent my migraines has made a world of a difference. I feel like I got my life back in a way. I got really emotional when I was talking to my doctor about it. I'm like, I felt like there was so much time that I lost because I was in pain. Got on medication, life-changing for me. What options do kids have? We see the commercials on TV. Qulipta, you talk about Qulipta, Aimovig. I mean, the list is long for adults, but what options are there for kids?
Sure. So, when I see a child in clinic, it's always kind of patient dependent in terms of what we kind of decide with the patient and the family. We sometimes start with the less invasive approaches like the CoQ10 or magnesium. But if that's not helping, then we quickly move on to some of the other more conventional prescription drug treatments like amitriptyline, which is a older antidepressant, or topiramate, which is a anti-seizure medication. But, all medications do have potential side effects. And so, unfortunately, with some of those tried and true medicines that we have, they either work great but they have a bad side effect profile, or they just don't work. And so there have been some, recent developments, as you mentioned, with some of these newer drugs that they're approved in adults. They're not currently approved in children, but we are kind of looking into those medicines in children, and hopefully there will be kind of an expanded use for that in children at some point in time.
Norton is also doing a little bit of research into that, finding some relief for kids. What are they doing, and what can you say about that?
Yeah, without getting into too many details, we are kind of looking into some of these newer treatments that are kind of more specifically designed to the migraine pathway, whereas, amitriptyline's an antidepressant and topiramate's a seizure medication. These newer drugs are kind of designed for migraine specifically and may potentially have fewer side effects. So I think it's a really exciting time to be a headache neurologist, and so I'm hopeful that we'll be able to more readily give these medications to kids in the future.
So what you're saying basically is that the options that adults have, kids that directly impact the migraine and helping with that, they're not necessarily directly available for kids yet, and we're looking into that. But we found other medications that could possibly help relieve some of that pain from the migraine that could help kids.
Yes.
Okay.
And there's a lot of exciting new treatments too. There's even like devices that you can wear on your arm and on your forehead that are kind of non-medication options for headaches. So there's a lot of choices.
So I know when I was going through this, one thing that you have to keep track of is how often are you getting these headaches? Where are they starting? Are they starting on your left? Are they starting on your right? What were the symptoms that came along with it? So as a parent, I think if your child is having headaches, kind of keep track of that. Just kind of keep note and talk to them. Tell me where it's hurting. How did it start? For some people, it can be, they notice something's wrong when they're looking at I know for me, a moving screen, like scrolling through the computer.
Sure.
So then when it came to work and I had to read off a prompter, that was horrible for me. It was really hard. But keeping track of those things, noting what becomes harder as you're dealing with that migraine can help your doctor kind of figure out what's going on too.
Absolutely.
Yeah. What did I not ask you, Dr. Dahl, that you feel like folks should know about? Where do they start? If their kid's having headaches, do they start at the pediatrician? Do they directly go to someone like you? Where do they start finding a way to relief?
I think the pediatrician is a great place to start. Migraines and headaches are kind of one of the top reasons for visits to a primary care physician. So most providers are well-versed in dealing with headaches. Now, when it comes to headaches that become more frequent or resistant to kind of our typical first-line options, then that's a time that they may need to come see a neurologist.
Okay. All right. Thank you so much for joining us here. Dr. Dahl, thank you so much for helping our viewers today, giving them some advice on this. I'm Myra Ansari with Dr. Dahl from Norton Children's. Have a great day.